Okay, so I'm just gonna first verify the provider's orders as to what we're doing today. It looks like we're just checking the tubing for a chest tube. I'm also gonna verify kind of the previous documentation for this chest tube. So I'm just gonna do hand hygiene and introduce myself to the patient. Hi, my name is Avery. I'm gonna be your nurse today. Can I verify your name and your date of birth?
Alphaba Throp, December 12th, 1997.
Awesome. Okay, Alphabet, today we are going to be going through and just looking at your chest tube. I'm just going to be checking to make sure that the bandage looks good, that the tubing's looking good, and that the machine's working properly. Before I do that, I'm going to do kind of just a little workup, check your vital signs, check your pain score, things like that, and kind of explain to you what's going on. So first, I'm just going to put on a pair of gloves. Okay, and I know that you've discussed like your pain goal in the past with nurses. On a scale of 1 to 10, 1 being no pain and 10 being the worst pain you've ever had, what's your current pain score at?
I think I'm at about a 3.
Okay, awesome, that's great. We want to definitely keep it there and keep it within your pain goal. If you feel like it's getting worse, definitely let us know. Use your call light right here so that we can stay on top of that with your medication, and if we need more medications, we can talk to the provider and see how we can best manage that. But I'm going to get a full set of vitals, so I would get heart rate, blood pressure, temperature, pulse, oxygen. I'd also get like respiration rate, and I'm going to listen to the heart rate and lung sounds. So I'm listening to the heart rate and to the lung sounds. Everything sounds good and looks good, so we're going to go ahead and continue with our assessment. I'm just going to pull the bed sheets back, and I've already provided patient privacy for the patient so that we're able to perform this exam. So I'm also going to lift this up so I can inspect your dressing. As I'm inspecting your dressing, I'm just going to look to see if there's any drainage, any redness, swelling, if the chest tube has been pulled out. According to the last documentation, it was at about 23, which is still at. And then after I've assessed, I'm going to palpate. I'm just going to see if there's any drainage that comes out, if there's any lumps, or if there's any pain and tenderness when I do that. Is there any pain when I press there?
No.
Okay, awesome. So first, after we do that and we palpate, if there was any drainage leaking or anything like that, I would change the dressing, but it looks good right now, so I can leave it. And then without pulling out the tube and making sure it's secure, I'm going to trace it to the machine. I just want to make sure that there's no kinks, no looping. The machine would be on the floor below the patient's chest level to help with gravity with the drainage, but for the sake of simulation, it's going to be up here. But again, we just want to make sure there's no loops or kinks, problems with draining from the chest tube. Now that we know it's all connected, everything looks good, I'm also going to trail this to the suction. For the sake of simulation, it's off, but it would be turned on to continuous according to the provider's orders. And we just want to make sure that everything's connected and working properly. Once those have been verified, I'm going to go to the machine and I'm just going to check that everything looks okay here. I'm going to check this bellow just to make sure that it's inflated. Usually it'd be in this window, and it won't be under inflated or overinflated, and it'll be kind of auscultating to the same as the patient's breath. And then we're going to follow the water seal chamber, make sure that's at the 2 centimeter line, which it is. Normally it would be kind of bubbling again with the suction. If it's over bubbling, that means there's a problem with a leak in the tube. If it's under bubbling, it might be clamped or kinked. So if there is any problem with like over bubbling, we troubleshoot by using this clamp and starting at the patient and working down at 10 centimeter intervals, only clamping for a few seconds. And if it stops bubbling, that means that it's working properly, and we go until we find where the leak is. We also will have Vaseline and gauze at the bedside where we place over the tubing to close that leak just temporarily until we're able to get that changed and new tubing provided. So again, water seal chamber looks good. For the sake of simulation, the bubbling is appropriate. We're also going to check the drainage from the patient. We want to make sure that it hasn't abruptly changed in amount of fluid or the kind of fluid that's being produced. Right now it's serosanguinous fluid, which is what we normally look for. We don't want it to be discolored or frank red blood or anything like that. So everything here looks good. Again, you'll have gauze, Vaseline, and a clamp at the bedside to kind of troubleshoot those problems. Again, if there was a bellowing problem, we would check this section, but everything looks good right now. So I'm gonna go ahead and close this up. Some things that we just want you to watch out for, again, is that excessive bubbling or not bubbling in that chamber. If you hear any sounds, if you're having any pain, those are kind of things that you would notify us with for the call light. We just want to make sure that we stay on top of it, that there's not any risk of infection or problems with draining that fluid from your lungs. The reason why we have this is because we want to have equal pressure in the lungs, so your lungs can inflate and you can breathe normally. So that's the purpose of the chest tube. Do you have any questions for me about that?
Nope.
Okay, awesome. So yeah, we're just going to continue with this. The provider's orders will kind of maybe change depending on how well you're doing, how your condition is changing. So further treatment will just kind of be based off the provider's orders. We're going to be checking on you regularly, but again, if you notice any of those signs, if you're having any pain, leaking, anything like that, use your call light to let me know. I'm going to take off my gloves and perform hand hygiene, and I'm going to go document all of these findings, the patient's tolerance to the procedure, any changes that I've noticed, and just kind of what was done today. We'll be back in a little bit. I'm just going to make sure side rails are up, bed is in low and locked position, the head of the bed is slightly elevated, and the call light is here. I'm going to go document those findings.